So thank you, Chief Secretary of the Tobago House of Assembly, Honorable Fali Augustine, Acting Senior Superintendent Junior Benjamin, and Acting Superintendent, Karen Stewart Duncan of the Trinidad and Tobago Police Service, Tobago Division. So we are set to begin this afternoon's Post-Executive Council media briefing. Addressing the media this week are the Secretary of the Division of Health, Wellness and Social Protection, Dr. Faith 𝒂𝒊𝒕𝒉, and the Secretary of the Division of Settlements, Public Utilities and Rural Development, Assemblyman Ian Pollard. I now hand over to Assemblyman Dr. Faith 𝒂𝒊𝒕𝒉.
Thank you, Davia. Good afternoon, Tobago. Good afternoon, Trinidad and Tobago. Good afternoon to the listening and viewing public. As a Secretary with responsibility for health, wellness and social protection, I'd like to take a little bit of time this afternoon to chat briefly about an announcement that was made in the Trinidad and Tobago space as it pertains to COVID-19 no longer being classified as a pandemic and being endemic, and what that really means for us on the island. I would start by doing a couple descriptions or making a couple definitions. There are three specific definitions that I would like us to think critically about. The first one is epidemic. Now, this is a term that you've been hearing. An epidemic refers to an increase in cases as it relates to any disease, any infection, any situation. So, for example, we went from having no cases of COVID to having multiple cases of COVID in 2019, early 2020. We experienced what is known as an epidemic. It's important to note, though, that even though we use the word epidemic and we think an epidemic requires a large increase in cases, that is not necessarily the case. If we have a situation where we had 0 cases before and we suddenly now have 10 cases, even though 10 may not be classified as a large number, it is still considered an epidemic. Allow me to then go on to the second definition, and that is a pandemic. A pandemic happens when we have an epidemic throughout the world. So if you recognize in early 2020, the WHO quickly defined a COVID-19 as a pandemic throughout the world. That is because we had cases, an epidemic of COVID-19 cases in every country or in every region in the world. And that is the definition of a pandemic. We are 2 years or so into it now, and we are therefore moving to another phase of the infection. And that phase is known as an endemic. It's important for us to realize that an endemic does not mean that COVID is over. As a matter of fact, the reason I am here is because I want to stress that an endemic does not mean that COVID is over. In fact, the textbook definition of endemic is one where you have a high but constant high rates of infection of a particular disease. So in this situation, we have a constant but high number of COVID-19 cases circulating in Trinidad and Tobago. And that is why we are now moving away from the system that we were using before, where we were trying our best. We were trying our best to prevent individuals from getting infected. We were trying our best to treat with those who were infected, because we recognize that in many instances, those who were infected got very ill, unfortunately got seriously ill, and some unfortunately died. So we are at the point now where we are trying to treat with the infections consistently throughout the country without doing the kind of disruption that we've had within our healthcare system for the last 2 years. Now, one of the things we have to think about COVID is that, I was listening to a sociologist a couple weeks ago, and he actually said that the thing about COVID-19 is that it is one of those diseases that is a little tricky. See, it's tricky because when you get it, it is not deadly enough so that everyone dies or so that the majority of people who get it die. Because it's not killing us the way other infections killed us, we are kind of thinking that, we don't need to be too concerned about it. we don't need to be too careful about it because the rate of death is not as high as, for example, Ebola. Ebola, for example, had a 50% case fatality, meaning 50% of the people who got Ebola died. We were seeing that. For COVID-19, it was closer to 1%, and in some instances, less than 1% of the individuals who got COVID-19 who got very sick and died. And because of that, we are now thinking that, you know, we've changed from the pandemic to the endemic stage so we could relax. The reality is no. We can't relax. The reality is no. We do not know what is going to happen as it relates to the level of infections for COVID-19 over the next couple months. If you recognize last year this time, we were actually at a lull, and we made the mistake at that point of thinking that the COVID-19 pandemic was over. We made the mistake of thinking that it was over and that we could relax a little bit. And we realized shortly after that that we had boom, cases, boom, variants, boom. We are now talking about things like Delta. As a matter of fact, coming to the end of last year, we had some of the deadliest months. October, November, December were some of the deadliest months as it relates to COVID-19. And that actually happened because of, one, the variant was a little different, but two, because we had not prepared our system to treat with a re-emergence of COVID-19 cases. I am therefore really warning us, and I've decided to come on today to spend the time to warn us to not get too complacent. Do not think that at the end of this, that we are at the end of this. Do not think that COVID is going away. We literally do not know what will happen in a month. We've been seeing waves, and waves go up and come back down, up and down. We are now at a point where we are at a down, but heaven knows what will happen in a couple weeks, in a couple months. So I am encouraging everyone to continue following the guidelines that we've been outlining. One, wash your hands with soap and water. And ensure that you use the soap on your hands and you rub your hands vigorously with the soap for at least 20 seconds. We are doing this because the soap actually breaks the protein ring that is around the virus, and that causes the virus to, in essence, die. We are also asking you to keep wearing your mask because just in case we have a re-emergence of this thing, just in case we have cases coming back up, you know, after Carnival, after the little relaxing that we just did, we are protecting ourselves. Keep the distance, keep at least the 6 feet apart, because we recognize that when the virus comes out in the mucosal, in the mucus droppings that comes out of our mouth and our nose, it actually falls to the floor before it gets to the 6 feet window. And if you are not well, if you are not feeling well, please stay home, because it is at that point where you are more likely to get infected. Let us not take this opportunity to go wild. Let us not think that we are over. Let us not relax, because we are not sure what is going to happen within the next couple months. Even though that is the case, though, we are recognizing that the world is moving back towards some level of normal, some level of closer to normal, because we are not quite there yet. And because of that, I would like to publicly indicate that several things are returning to a level of normalcy within the Tobago Regional Health Authority. One of those is what you've probably already started experiencing over the last couple weeks, and that includes a return of our outpatient services at the Scarborough General Hospital in Signal Hill. If you've had those outpatient services, outpatient clinics, you've probably been called and told you can come back to your clinic appointments. Listen for those dates. The other thing that is about to start back within the Tobago Regional Health Authority is the reintroduction of what is our elective surgeries. These are the surgeries that, you know, we've had to call off. These are the surgeries that we've had to postpone for the last couple years. You are going to start getting calls from the hospital to come in and have those surgeries done, because we know that you've been waiting for quite a while to get those surgeries done. Again, we can only go back to this level of quote-unquote normal because the number of cases we have right now are relatively low, and because Omicron, thank God, is not getting people as sick as we thought it would have. So they are not coming to our hospitals and they have very mild disease. It's important to note, though, that for us to continue having these elective surgeries, I need your help. I need those of us who are on the island who are able to donate blood to please do so, because this is one of the determining factors to tell us whether we can have the surgeries or not. Now, the thing about these elective surgeries is that when you go in, it may be something that is minor, but if you go in and you need blood, the blood needs to physically be at the hospital for us to have access to immediately. It means that you need to start donating blood now. If you've never donated blood before, that's fine. The number for the blood bank, 660-4744, and the extensions are 3098 or 3099. Let me repeat that. 660-4744, and the extensions are 3098 or 3099. If you are interested in giving blood, if you know that you have a family member who needs to do an elective surgery, this is an opportunity for you to possibly speed up when they get that elective surgery by coming out and donating as much blood as possible, because that is one of the determining factors in how quickly we get these elective surgeries out of the way. I would like to touch on one quick thing again before I close off, and that is the fact that unfortunately yesterday we had an accident in Tobago that involved one of our ambulances and another vehicle. I would like to say that that was a very unfortunate event. All of the individuals who were involved in that event are okay-ish. Some are in need of treatment that is a little bit more than, they were not able to be discharged. But those individuals are being treated, and they are being treated very well at the Scarborough General Hospital. We are working very closely and in close contact with the family members and so forth about those individuals to ensure that everything works well. It's important to know that that accident now means that we have one less ambulance. Yeah, we have one less ambulance. We have 8 ambulances that are functioning now, and we've been in close communication with the TRHE, and they have assured me that they have reprioritized where those ambulances are placed, where they are being dispatched from, and the removal of that one ambulance from the system for this short period should not affect the response time and should not affect us being able to respond to you if you have a medical emergency. Of course, because of that, I am asking everybody, try to not have to call the ambulance now. Try to not have to do anything where you need the ambulance. Please be safe. Be safe. Be safe out there, and ensure that, for the next couple of days, we don't have any more accidents, we don't have any more incidents, and only those who absolutely need to have medical attention should call the ambulance for that service. With that, I would like to pass back to Ms. Davia Chambers so that we could continue with the press briefing.